Hi, I'm Dr. Claire, and today we're crashing your top questions in women's health. What are some of the important aspects of women's health? So I'm going to start by saying probably all of them, but basically you should be thinking about coming in to see your doctor at every stage of your reproductive cycle. So we're going to start with when you hit puberty and you start to get your menses, come in and have a discussion. Then we go into the time where you're thinking about fertility and conceiving and having a baby. And throughout the pregnancy, up until childbirth, we'll look after you during that phase as well. Finally, another important aspect we look at with women's health is breast health and menopause and the changes that happen, especially so with your heart health after you hit menopause. Another important aspect, of course, is breast health, and this is going to change throughout your life from all the different phases that we've just talked about. So again, it's important to have conversations as you continue with your doctor throughout. Finally, there's menopause and the changes that happen when we finally come to the end of our reproductive health journey. It's important, again, to keep up with your appointments, and especially so when it comes to other systems, because your heart health starts to be affected as well as your bone health. Next question. How do I choose a birth control method? So there are various things that you need to keep in mind when you're thinking about your birth control. The first and most important one is whether or not you can fit it comfortably into your lifestyle. Is it something you're going to have to take every day and remember to do so? Or is it something that can be put in for you during your appointment and then you don't have to think about it for a few months or a few years to come? The next thing to think about is how long you're thinking about postponing childbirth. Are you thinking about not getting pregnant for a long period of time, a few months or a few years, or are you thinking about spacing between one child and the next? That's an important thing for you to consider. Third thing to keep in mind is whether or not it's going to affect your cycles. Some birth control methods are going to stop your period from coming altogether, whereas others will make it a bit more regular. So have this discussion if it's something that you feel will affect you. Another important thing to keep in mind is affordability. Is this something I'm going to have to pay out of pocket, or is it something my insurance is able to cover? Is this something that's going to be extremely expensive, or is it actually subsidized or provided for free? Another thing to keep in mind is whether or not it's going to give you protection from sexually transmitted infections. Most contraceptives don't protect against STIs, and so you will probably have to combine with a barrier method such as condoms. So keep this in mind when you're talking to your healthcare provider about your contraceptive option. Well, that's it for today. For more fun and informative medical information, follow us on Tibu Health.